drug and substance abuse in the country. Good morning and welcome to the program. Good morning, Sanu.
Good morning.
Okay, we get to the other studio guests when journalists and commentator. We don't comment on different things that we get to do with national issues. Then when Melvin Tejan Mansaray. Good morning, Melvin, and welcome to the program. Good morning, Sanu.
Plenty thank you for when I get me and family on Kush and Kabo.
Okay, Government Insight 2024 April 4 been declare emergency on drugs and other substance abuse. And after we government we don't declare emergency, government be set up multi-sectorial national task force on drugs and substance abuse. Was a different player in camp for addressing the we get for do with drugs and substance abuse. And this task force, now the vice president, the chairman from that assembly to now, they don't update the president on waiting on the happen on drugs, especially Kush and other one them. But how this don't they work and waiting at some of the things they don't put in place for to say they address them here, make we get the national coordinator, when our professor sir. And from that small background where I don't give for Sika, we government will set up this task force and say we government will declare emergency on drug and other substance abuse them. Waiting on the happen so far, now we talk about the current drug situation at the country, more especially talking about Kush, Tramadol, TM and other one them. How in the right now in the country?
Thank you very much. We government set up the task force in April. I think we immediately set up 5 pillars. One for improve awareness messaging across the country. We, the Ministry of Information and Civic Education, they lead that pillar there. And this now for take the message on the bad effects on Kush, now the last part of this country. Then we set up the second pillar with our community engagement with the Ministry of Local Government and the leader pillar for making sure to engage chiefs, religious leaders, traditional leaders, them, because in anything they do, we can forget community ownership. So that is we don't go on. Then we'll get the treatment and care pillar with Ministry of Health, the leader pillar later. They want them with the young Kush, where they get overdose so that it will detox them and whatever. So inside that pillar, they've been very active. Then we also get the rehabilitation and reintegration pillar with the Minister of Social Welfare, the leader pillar there, for set up rehab centers for make sure say we take them through rehab and at the end of the day we integrate them back into society. That the one that they go college, they go back to college, the one that they work, they go back to the workplace. Then we get the law enforcement pillar, one very important pillar, where in now for dismantle the supply chain. That particular pillar the National Drug Law Enforcement Agency, the Sierra Leone Police, the Republic of Sierra Leone Armed Forces, the ONS, and other partners them. Now them they did that pillar there, and then don't they work very diligently. They don't do a lot of arrests and make sure say they cut down the supply chain. So in anything what they do for the past 1 year, all them 5 pillars them be active, and that's what they do.
So talking about them pillar they are on a set up no. But of recent, we see the kind way how Kush and other bad drug them, done the rampant in the country and all. So how in Sanlek and how them pillar don't they work for CC unable for attack this thing and put a stop to them?
Yes, in any part of the world, drug fight, not a one-day fight. It could be a sustained involvement. And this Kush not a Sierra Leone problem. Internationally, West Africa considered as the hotspot for synthetic opioids now. So government itself don't do everything possible, and with the engagement of with the His Excellency the President, he don't put new vigor. We don't actually put extra measures to make sure say we continue what we do. But definitely the structures are there, and they do everything possible for make sure say this menace will take out of this country.
All right, as you mentioned, say get a 5 pillar, one get for do with awareness messages. We are the Ministry of Civic Education, Community Engagement, Local Government Treatment Center, Ministry of Health, Rehabilitation Center. We get for do with Kush. We get the law enforcement body then for dismantle the supply chain. All them 5 pillar, you agree with me? Say they know me the function as is supposed for.
They will function as they're supposed to function.
But why we still get?
As I tell you, Kush down there in this country from 2016. So something we done there for over almost 10 years for say you will just eliminate it inside 1 year, it's completely impossible. America, we get all the resources we available to them. They don't defect drugs there for the past decade, how many decades? So definitely government don't do everything possible, and they provide the necessary resources for make sure say we handle this problem.
All right, Kush done there from 2016, but in a recent time, it more worsened than ever.
If you look at the statistics of what happened in other countries, then you will see say not a Sierra Leone problem. The same thing happen here.
We put her in salon context.
Yes, but when they do salon context, you got to make comparative analysis of what happened in other country, because people when they feel say now just a Sierra Leone problem, it's not a Sierra Leone problem. As I say, we don't affect Kush and the resource system, then government don't make them available, and government don't make more resources available. With the current announcement for say they set up a special fund for make sure say it dedicated towards fighting of Kush. So definitely we do what we're supposed to do for this country.
And Doc, we can talk on the difference in the way presidents build the tax force, we go update the president's Friday and all. Now you're talking about say Kush now, drug abuse don't be one big challenge on the African continent and no bring them down to Salon. Talking about Kush, waiting are some of the things and the kind of drug them where people they take where came then at the rehab center they from the different findings they wanna don't get under the Salon context.
In the Salon context, we don't find out for say Kush now is a combination of substances. Then they come in an inactive form. Everything where they try for assemble on Kush now outside this country they come from, so that people they bring inside this country. It become as harmful, as harmless things that like marshmallow, acetone, and other things that they can assemble and hire. So we get a lot of people that way then they on Kush as abuse substance. We get a lot of people that will take tramadol. We get people that will take heroin. We get people that will take cocaine. People that will take marijuana. So a lot of illicit drugs and the way they exist in this country.
Though with all land drug they will experience people and they take who's one day on the increase?
All on the increase. You don't take anyone away. Kush, you will say it on the increase because 90 now the limelight now because it's cheap. It's cheap compared to heroin. It's cheap compared to cocaine. So somebody who gets initially it was like 5 leons, go to 10 leons now. Some people are now 15 to 20 leons. So it's cheaper. So now make it spread like wildfire in this country.
All right, as you say, most of them think they come out now other countries, but we get different border points them, and we get people where they head some of them border points, then they get land, we get air, we get sea. But the allegation are that people within at them points then they mostly na denki allow them thing then they for come in. We mean say proper security, not in at them points then they.
When I make president engage, we engage all the stakeholders that were involved in this fight for make sure say everybody do what they do. If you listen to what the president says, anybody when they find out for say they collude with them rogue people that want to bring these things into this country, say there will be no sacred cows. Anybody will involved, they say the law they hit them hard.
All right, now let's look at again the center, the rehabilitation center. Some time back, we understand our allegations say money no day for the function of the center. You are aware of that?
Well, anything where they do, I mean, government not they do everything at a go. We definitely we will get some constraint, but as at the talk so now, we don't activate PTS. We don't take over 107 people. We don't activate Daru. We don't take over 50-something people. Then this week here we activate Budama. Then what do we intend for do? For make sure say we brothers them or sisters them whether in the street and take them out of the street. We want to establish more rehab centers by converting some of them MPOC centers that would exist. We convert them to rehab centers so that we will take as many people out of the streets as possible.
So meaning money day now for the function of the center then?
Money day.
Okay. The program now Good Morning Salon where they come to you live from Radio Democracy 98.1 FM. As you hear, one of our studio guests, Melvin Tejan Mansaray, political analyst and journalist. We done the comment on different issues there we get for do with national development. Good morning once more, Melvin. Welcome to Radio Democracy.
Thank you very much for having me.
Melvin, the fight against Kush, as my colleague earlier on mentioned, since 2014, the president declared as emergency. We mean say a very serious issue. From that time day to now, how you will rate the fight against Kush, Nasser?
Wow, that's an impregnated question. But if we use simple indicators such as the observation tool on the number of victims we all believe say affected on the streets, the number of deaths, the number of cancerous sores, we get one for all agree that government declare public emergency, yes. Unfortunately, the goal was to reduce the rising phenomenon. But a year and a half later, we ask ourselves, how comes the phenomenon don't get so higher? So if some people say 2014 or 2016 Kush has been here, that cannot be argued. That is a fact. But the fact also is the fact that the proliferation of Kush and substance and drugs, they don't ballooned, they don't exponentially increased. We ask, what has this task force been doing for the last 1 year, 6 months? Of course, it has been a public conversation on, firstly, the strategy and when it was developed and the visibility of the task force itself. The task force came to visible light after I think it was 2014 press conference, just after we see President Bio go visit the rehabilitation center. So we ask, if this task force was established under a public emergency declaration, and a year and a half later, the task force is now coming to update on its numerous glorious stories, so-called glorious stories. The question begs, where is their report for at least for the fiscal year, the 1 year, don't forget about the 6 months, the 1 year where they operate for? And thankfully, we get somebody from the institution. We will talk about that, because I've been asking, where is their report? Because one of the pillars talk about data-driven approach. It's one of the strategy. And if the government and partners are coming on board this fight, there's a need for data, basic data on what's the, I mean, if it's in minute to scientists, in the case of epidemiology, as what we learn from COVID and Ebola, we'll get to and call infected cases, recoveries, and all that. We get data for that. But in the case of in the case of Kush and substance abuse, I stand for be corrected. I don't see any data so far as we don't do on COVID and Ebola. And back to the issue we got for do with the president. I'm a bit reserved when it comes to the task force, because in one of the engagement, the president said he was briefed twice. And you ask yourself, if the president declared a public emergency on this issue, how we get for take 1 year, 6 months for visit a rehabilitation center? Was this the case when it comes to COVID-19 and Ebola? No. How comes you get for take the president now the 7th discharge cases for let a pledge say I will go there? So for me, I think a lot of lip service was paid at first, and as at now, it seems as if, due to quoting the words of the president, people are going to radio and talk boku, which means the media and public pressure might have done trigger the president visit. It speaks to the fact that yes, we can do more, and the task force can do more, in particularly the areas of getting itself more visible and implementing the other pillars. So I think they can do more. And now that the president is saying that they were briefed, it was briefed twice by the task force. I asked for 1 year, 6 months, not 2 10 I go brief the president in his own words. So I think the task force needs some review. It's not just about reviewing law enforcement, removing MKLU from Toku. It's important, it's significant to show political commitment, but I think the big onus on this fight, yeah, you can question NDLA and Ministry of Health, Ministry of Social Welfare, but directly under the public emergency, I think the task force has a lot of explaining to do, which they've not done over time.
Melvin, The president's way be gonna the place to say according to him na the first thing and they were gonna that send the rehab center and it be so touched with some of the states the testimony of the and all. One people gonna say the task force people and not only brief the president or not only tell the president the right thing where he can ban this drug abuse in the country, more especially Kush and other one them. What do you make up of that?
It will be a lame blame on the task force only. There is a doctrine of greatest responsibility. The person who in charge of the task force was appointed by the president. You don't need for we don't declare public emergency. You don't need for task force who can brief you. You have a duty as the head of state and government for summon the task force for either quarterly meetings or engagements. So in as much as the task force might be blamed for not being proactive enough, but the president also can be equally blamed for declaring a public emergency and allow the whole one of the whole pillar. In fact, the president exposed and embarrassed the government by saying that I'll not be no because I'll not be don't care. That for me as a citizen of Sierra Leone, I felt like, oh, that's a neglect of duty.
Plenty people believe say people where they fet the Kush or drug issue in the country, not done they brief the president the right thing. You believe in that?
Not to the people and the people that be votes for. Now the president that be votes for.
But still the president not able to do thing in one.
He provides oversight duty over every arm except for other independent arms. So if you are the head of the executive, your duty, especially after declaring a public emergency, is for you to be regularly briefed. The people in Kane, Nokawo, Ebola been there, we see how government respond. We see EOC. Where COVID, we see how these very governments respond to it. So how this time, we cannot blame those people. We blame the greatest bearer of the responsibility, who is the president, we seemingly perhaps not being take the situation as we see now.
All right, according to Prof, now that let me get 5 pillar awareness messages we get for do with the Ministry of Civic Education, Community Engagement, Local Government Treatment Center, Ministry of Health and Rehabilitation Center we get for do with social welfare and law enforcement for dismantle the supply chain. Then 5 pillar there for the past 1 year, don't they function well?
I am not working inside there, but what is on paper on the strategy, one of the strategy was to have rehabilitation centers in 16 districts. As a journalist, empirically, I will tell you that that is not the case. There are several other strategic policy actions that we are supposed to be taking. Some are being taken in terms of intervention on removing them from the streets and all of those things. But apparently, when it comes to, for example, taking them back to schools or admitting them into tech vokes, we need the data on that. So there are a lot of strategic policy actions outlined by the government, but you'll have to take them piece by piece. Another pillar is risk communication. You ask yourself, who's almost public information education jingles like we used to see Ebola, where we get on Kush coming from the aspect of the collaborated team. So a lot of policy actions outlined, and if we want to do a dissection or a dialection, definitely we'll take them one after the other and look at pointers. Is there any public education message in the public domain? Then give any jingle for the play on Kush, 98. Unageni.
We're not aware of that.
So, and it was a commitment. It's a commitment in the strategy. So if those things are not implemented, I don't know. Somebody must answer those questions.
Okay, Melvin, continue for the program. Not come over to Doc. The president's been go na the center Friday, and we've been there. According to the president, and the first time they ever visit this center, one go and say the president visit this center because of the kind way how plenty people don't talk in the president's words, people don't explain and not even the way say people for come together and fit this Kush fit. Why not the first time the president's brief and the president don't declare and go na this center don't declare emergency? What in the task force don't they do?
Thank you very much. I want to start by maybe educate me, colleague. I think one is there is no report. There is a report where during our engagement with the president, if you will follow, we hand over the 1 year report to His Excellency the President. Number one. The number two, for say there is no statistics, you know, correct. There is statistics. If you look at your report, 98.1 get one copy of a report.
On the day when I go present to
No,
president.
before this time, over 2 months ago, you know, I get two reports, one from a journalist and the other one from Dr. Spencer. I don't key all the stations there, then get reports. Then the third one for actually educator a little further is like when the task force was formed, it for be under the supervision of the vice president, and this task force will brief the vice president every week. So for talk for say government not, I mean the task force not be the brief the leadership, that is not correct. I think there's some things that if you don't know, if I like ask questions.
But again, Prof,
Yes.
it's like say the public day in the dark. Now you don't confirm say yes every week.
No,
but
problem in that, because I mean inside this station here I don't count over 5 times. 5 times radio engagement. When the task force form, I don't count this station, I don't count all stations, television and radio for brief on the activities of the task force. So for the public in the task, I just surprised.
Yeah, no, because it's okay, get emergency. We know we get Ebola, COVID. We see the kind way how the public be so aware about this and all. But in terms of Kush, you're talking about the pillar that we get, the one for his awareness, the other one them. Now because things don't worse now, don't begin here, but we not get even win a 98.1 here. You don't care how they invite you. But talking about jingles, them with the other time they can get an emergency in a radio, the other side okay, see, we not only see that much public awareness.
You know, again on the jingles, we don't translate the message in 6 local languages. I shot 98.1, then get the copies of those messages. So for no, I get them because I shot if we're going to our archives, they don't the messaging. I mean, translated into 6 local languages.
Doc,
television and radio.
Prof, I can tell you say
Yes.
na we the supervise that department.
Yes.
And if we tell you say we not get.
Well, unfortunately for say, I mean, like ARC is something. I mean, I don't know, maybe lapse in our communication line.
No, okay.
But definitely,
Prof, not just make it clear.
Yes.
Now we supervise that department. Then I
Yes.
made the input and pull jingle them. I
Yes.
can confirm with you say we not
Well,
get anything of that.
okay, well, I mean, in that case, if I start that you don't say, I will reach out to the Ministry of Information and Civic Education because definitely they don't translate that into 6 local languages and definitely they disseminate them widely. Then in respect to data, it's so unfortunate for say some things the way they happen, you know, as sure say as journalists for let you come talk say this not they make sure say you get evidence. There is data, there is data on everything that we do. We'll get data before the pronouncement and we'll get data after the pronouncement. As I said also off my head, and I tell you for say from 2020 to 2023, we get 1,300% increase of Kush admissions now, Kisi Psychiatric Hospital. Then from the time of pronouncement to date, Kisi Psychiatric Hospital see over 5,000 cases. Then how many were na Kush? Over 1,337 na Kush. So all this data is available. All this I will report, and will reports being disseminated widely. So some things and they are sure say you could find. Then we'll take a back seat, ask if you don't get the response. There is the office is open to everybody. For let it go, you get the information we want. If you don't get on the street.
Okay, the quick one before going to break. Talking about the president visiting the center for the first time, and according to you, not only updates the vice president on them. So now that first time they know the president visit they on now because of the kind of people they only talk me the president say let's go get the first hand information.
Well, president intend to go for first hand information definitely, but you know me say if the president not go, that means the government not concerned. The vice president don't go, the chief minister don't go, other ministers they don't go. When they discharge the patient, then the chief minister don't attend. When they admit the patient, then the vice president don't go. So you know me say if the president not go, that means the government not concerned. No.
Okay. In Salon, they come to you, and inside the program now, we continue for look at issues them. Inside 2024, when President will be declared state of emergency on drugs and other substance abuse, the Ministry of Social Welfare will be opening a rehab center and Estin for teens, Kush, and other drug addicts. But for 3 months now, this facility be don't lock because government not been gets the copper for continue for run the center. But according to the Minister of Social Welfare, Melvin Tejan, government don't get copper back for admit 100 young people in the facility. We reporter Chelno Jalo be look inside this and put this report together.
atmosphere na the Eastern Peace Mission Training Center been mixed with heartbreak tension, as the face of comrade dem go tell you say they're not glad for wetin dem pikin dem dey go through, and during this time with heavy heart comrade dem been turn them back on them pikin dem. This come after the Ministry of Social Welfare be don decide for make the moment between them comrades and them pikin so over and begin for attend to the pikin dem. This na the 6th batch of pikin dem wey don go through this center. I meet the Minister of Social Welfare, Melvin Tejan, we describe the efforts as one of them successful and the fight against Kush, as it says 70% of people who don't pass through this center don't come back in society, and they do well for them and their family.
We have done 5 batches, and this is the 6th batch. I want to say that it has been a very good exercise, very productive one. We have had to discharge over 350 from this same PMTC, most of whom went back to college, back to school, because as you know, most of these young people are leaving school and college and taking drugs. Coming here again today to get this 6th batch of 100 that we are going to admit today. I think it's a good thing. The government is spending on all of this. That's why we call them victims.
Just 400 now, another 100 is entering the facility out of thousands of affected people. Is that not a little drop in a mighty ocean?
You know, I just came from Daru. We took victims from Kenema and put them in the Daru military base, where they are also receiving psychosocial support services. Those ones were 40, and we are adding 40 from Daru as well. And so we will get about an 80, and we are going to open back in Bo.
The Minister of Social Welfare also believes say if the Fed ban this drug for continue for get better results, the security sector need for arrest people who they sell the drug and serve broke place them who say they sell them drug here. Fatmata Tarawali now one Kumra when picking currently they inside the center and they receive treatment and sharing experience with me.
They feel bad and they cry because me picking me the college because of the drugs I left the college. So I know they feel fine. Anytime I see me, I see warm so that I can push her out. But when they came back, I pray for her. I pray for her. I push her drunk, but you know easy for Kumra. Till then, where the beginning they do a bad off. But then they die at it every day for these drugs here.
Ibrahim Kamara been attend the Frabi College, but for long time now, they don't drop out of the course and are part of the 100 young man them where the Ministry of Social Welfare don't put inside this facility. I meet and ask him what in think about this. First thing, when he tell me now how in life will look like before he come into these drugs.
I can say I be student. I be do Bachelor of Social Science and Law Social Work. But fortunately, due to some certain circumstances like drug, unfortunately get for dropout. So, and that not be good and well with me. Although we don't become addictive to this drug, and anything about that, because I addict deeply. So like I need get that thinking self say na good thing or a bad thing, what don't do about of the cause, I need get that. But like now the government and some people don't come together. They try to open some rehabilitation center then for rehabilitate we back and put you back in the form way you're supposed to do. I'm happy about that.
One thing well body people only talk now that drugs them like Kush, tramadol, another bad one them difficult for life and for seek help. Now one thing where plenty victim them not can really think about. So I asked Ibrahim Kamara but why he decide for register himself for this particular program.
I decided for turn myself up because a lot of things that happen in my life. First of all, the thing where they put me off totally in a way at times I can day lonely, I can see most of my party then we all enter university together, we all get the same ambition, get the same mindset. I see the most of them don't graduate now. they don't come to university, some of them they work. At some point they can see me now, alumni. We all we enter together at times I can peace talk.
Just like Ibrahim Kamara and the 100 people who don't enter this facility now, the only thing we don't get now hope say by the time they don't do 8 weeks in this center and come out, their life no go be the same again. For the Society for Radio Democracy, me, Nachang Jalo, the report.
Well, the program Good Morning Salon they continue. When it comes to the other studio guest Melvin, and you don't see the different, you don't hear from Doc, which they don't present to President, as according to Doc, they don't update the Vice President because they're not the chair for that task force the government be set up. Let me look now on the how the different government agencies they don't the work for say they able for collaborate, because if you watch waiting makeup of the tax force, you get different agencies we don't they work together. You as a journalist, you don't they watch around and don't they report on things that we get for do with this Kush and other drug them. I go rate them one day them performance. I think say collaboration don't they go fast for sake of the fight against drug in the country.
Well, if we use the burial of unidentified corpses on the streets and how the Freetown City Council and local government ministry and other state institutions don't they contradict themselves in the call for data, we'll say there is need for much more collaboration and coordination. Doc, I've been deliberately now for response to Doc, but since Doc don't give me beautiful education and edification this morning, I stand for seek some clarification. Doc, you say this report when I get in public. Yeah, it is on our website, sir?
Yes.
The report you mentioned?
Yes.
Okay. And you also say una be done the brief the vice president. Mm-hmm. So can we say that the vice president not be the brief the president, because the president say it was briefed just twice by
you don't say by the task force.
Yeah.
Yes, as a task force together, but the vice president they brief the president. They see on a daily basis. Anytime when they see they brief on a regular, anytime I get updates, it will go update the president.
So how comes the president in the engagement? Hold on, the president. The president.
Melvin, you can lay your basis now.
Okay. So because when you hear say the president say it not be understand how them pillar then they work, you ask how well briefed it was. That was what he said in public.
No.
Doc.
So now we go need your basis. We don't ask you how you think say collaboration don't they go, and you don't they talk about what you think of the Freetown City Council and the Ministry of Local Government.
So there was this issue on SOP. So I stand for be educated as to whether it exists as at now, the SOP. But of course, if you look at the mixed communication, the mixed communication on the part of government. By the way, let's not forget, all of these are happening under a public emergency. Not just a normal situation, it's a public emergency. So back on data, the doc like Ebola, where we will talk about number of affected victims. What's not the number of affected Kush victims that will get us alone? If we get the data. Do we have that data, sir?
Okay, maybe don't go
okay. So I think it's a conversation, not an argument. We're just educating the public. So in terms of data, I agree, say some data there, but in the real time, as we've been seeing with Ebola and Corona, Kush epidemic, not get that kind data structure there in terms of which we don't use to see on the basic epidemiology.